She was really in pain for such a long time and so brave about it.
This all started some time ago. I had a lot of knee pain, hip pain.
She'd call me up from the middle of a block and say, I'm not sure I can make it to the end of the block. Now it's just heartbreaking.
I couldn't believe that I was so disabled. I just couldn't accept it. I started visiting surgeons and getting different recommendations about what to do. Some of the other people I'd seen in New York had recommended just massive doses, both of pain meds and anti-inflammatories. So on top of the pain, I was really confused.
My biggest concern was finding the right place to do it.
A friend of mine said, why don't you talk to Dr. Rusinoff, go up there and just get a second opinion. As soon as we went to see Dr. Rusinoff, it's like, this is as good as it gets.
Of course I remember meeting Ronna. My name's Dr. Scott Rusinoff. I specialize in orthopedic surgery, particularly hip and knee replacement surgery.
It was really a terrific experience right from the get-go with Scott.
I was ready to go into surgery like the next week.
I think what makes Hudson Valley Hospital Center different is, first of all, that it's new and very fresh, which is wonderful.
When we were putting the joint replacement center together, we felt private rooms were very important to help decrease the risk of infection.
The infection rate was pretty much non-existent.
That people seem to be really committed to it.
And I thought, okay, they're going to really have the time and energy to look after me and also to look after Jimmy, my husband. We rehabbed from the knee, and I came back 6 months later and we did the hip. In the Joint Replacement Center, you have this group that's used to working together on patients in order to get you up and moving again, and it's seamless. I had really great nurses. I even had great night nurses, which is not so easy, and it's really important. Good pain management team. I got kicked out of regular rehab within 3 weeks because they said, you've already got complete range of motion. So I went back to yoga again at 6 weeks.
She said, look, Jimmy, there are a lot of cute young women in Lycra. You sure you don't want to come? I said, okay, I'll make an exception. But then the yoga itself has been amazing. I
don't really feel like I have limitations. Other than stilettos. I don't think I should be doing stilettos. This is where I loved getting better. They don't want to fix me, they want to help me. And that's what I want from a hospital.
That's special.
We call it patientology. You'll call it a better place to get better.